Welcome to Medicare 360 Show. I'm your host, Jennifer Lee, and today we are continuing our journey on the Medicare and You Handbook. So we are at page 71, section 4, Medicare Advantage Plan and Other Options. You could join, switch, drop, or make changes to your Medicare Advantage plan. Remember, you must have both Part A and or B to join it's not A and or B. It is just both Part A and Part B to join a Medicare Advantage plan during these times. So keep in mind that Part A and B, Part A, if you or your spouse work for more than 40 quarters, which is equivalent to 10 years, this is eligible at zero cost. And Part B, depending on your income, depends on that. But there are times that I do see clients with just Part B and not Part A. And definitely those are one-offs, but we could help you get Part A and see if you could get a plan. Let's go to initial enrollment period. Go to page 17. When you first become eligible for Medicare, you could join a Medicare Advantage plan with or without drugs coverage. If you joined a Medicare Advantage plan during your initial enrollment period, you could switch to another Medicare Advantage plan with or without coverage, or go back to original Medicare with or without separate Medicare plan within the first 3 months you have Medicare. So let's just say you're totally unhappy, you can go back to original Medicare within the first 3 months. Okay, general enrollment period. Go to page 18. January 1st to March 31st. If you have Part A coverage and you get Part B for the first time during this period, you could also join a Medicare Advantage plan with or without drug coverage. You'll have 2 months after adding Part B to join a plan. Your coverage starts the first day of the month after you sign up. So let's read that again. If you have Part A coverage and you get Part B for the first time during this period, you could also join a Medicare Advantage plan with or without coverage. You have 2 months after adding Part B to join in a plan. Okay. Open enrollment period, October 15th to December 7th. You could join, switch, or drop a Medicare Advantage plan with or without drug coverage during the open enrollment period each year. Your coverage starts on January 1st as long as the plan gets your enrollment request by December 7th. If you join a Medicare Advantage plan during this period but change your mind, you can switch back to original Medicare or change to a different Medicare Advantage plan, depending on which coverage works better for you. During the Medicare Advantage open enrollment period, January 1st to March 31st, described on the next page. So this is either the happy time or the dreaded time where you're getting a million phone calls, which is technically not allowed, or you're getting tons of mail, which could happen. Usually it's public information, or emails, right? So this is the big time where you're seeing a million of commercials on Medicare, actually even year round. From October 15th to December 7th to have a coverage start January 1st. Medicare Advantage open enrollment period, January 1st to March 31st. You could only switch plans once during this period. Coverage starts the first of the month after the plan gets your request. If you're in a Medicare Advantage plan with or without drug coverage during this period, you can switch to another Medicare Advantage plan with or without drug coverage. Drop your Medicare plan and return to original Medicare. You'll also be able to join a separate Medicare drug plan. During this period, you can't switch from original Medicare to a Medicare Advantage plan. Join a separate Medicare drug plan if you have original Medicare. Switch from one Medicare drug plan to another if you have original Medicare. You could only make one change during this period, and any changes you make will be effective the first of the month after the plan gets your request. If you're returning to original Medicare and joining a separate drug plan, you don't need to contact your Medicare Advantage plan to disenroll. Then disenrollment will happen automatically when you join the drug plan. Okay, tongue-tied today. Okay, I want to read that again. So if you're on a Medicare Advantage plan, you can switch to another Medicare Advantage plan. You can definitely go to original Medicare as well. But the biggest thing is you can't go to a Medicare Advantage plan if you're on original Medicare. You can't join a separate drug plan if you have original Medicare. You can't switch from one drug plan to the other. So that's why it is definitely important to go over your options from October 15th to December 7th for a Jan 1st effective date if you can't and those don't apply to you. What else can I say about this? A lot of people don't think they could change. They weren't aware of this type of change. Compliantly, an agent cannot reach out to you and ask you to change. It's just one of those things where, you could make a change and you could reach out to an agent at that time. So keep that in mind. Special enrollment period. Go to page 17. Qualifying life event. In most cases, if you join a Medicare Advantage plan, you must keep it for the calendar year starting the date your coverage begins. Okay. In most cases, if you join a Medicare Advantage plan, you must keep it for the calendar year starting the date your coverage begins. However, in certain situations, like you move or you lose other insurance coverage, you may be able to join, switch, or drop a Medicare Advantage plan during special enrollment period. Go to page 80. So special enrollment periods are typically, let's just say you have Part A, you get on Part B, and you do this because you're leaving a group work plan. So that is cause for a special enrollment period. Other enrollment periods may be that you're moving to a different county or state. Another special enrollment period is like the FEMA ones. If there's like a flood, rain, tornado, fire, things of that nature, that was declared a FEMA event, then insurance companies typically say, okay, you weren't able to make a choice because of all this disastrous things that happen in the world. You are able to use an enrollment period, a special one, because you weren't able to make that change. Okay. So 5-star special enrollment period, December 8th to November 30th the following year. Note, you could only switch plans once during this period. Okay, Medicare uses ratings from 1 to 5 stars to help you compare plans based on quality and performance. If a Medicare Advantage plan, Medicare drug plan, or Medicare cost plan with a 5-star quality rating is available in your area, you could use the 5-star special enrollment period to switch from your current Medicare plan to a Medicare plan with a 5-star qualifying rating. Visit medicare.gov for more information. So just remember, if your area or area coverage or county has a 5-star rated Medicare plan, okay, you are able to switch one time for that. So that's pretty neat if you want to be on a plan that has that 5-star rating. So important, if you drop your Medicare supplement insurance, Medigap policy to join a Medicare Advantage plan, you may not get the same policy back. Okay. If you drop your Medicare supplement insurance Medigap policy to join a Medicare Advantage plan, you may not get the same policy back. Also, if you want to return to original Medicare and don't drop your Medicare Advantage plan within 12 months of joining the Medicare Advantage plan, you may be limited in your ability to get a Medigap policy when you return to original Medicare. Go to page 78. In general, when you join a Medicare Advantage plan, you must keep the plan for the rest of the year unless you drop it to return to original Medicare within 12 months of joining the Medicare Advantage plan. You could drop or change Medicare Advantage plans during the open enrollment period or Medicare Advantage open enrollment period, or if you qualify for a special enrollment period. Okay, this was a doozy. This was a lot. Basically, it was just saying that, let's just say you're on a supplemental plan, then you join a Medicare Advantage plan. Technically, you can't go back to that plan without any underwriting, right? So if you have illnesses, you may not be able to get that plan. However, if you do drop it and return back to original Medicare within the 12 months of joining that Medicare Advantage plan, you will be able to without the underwriting. So this is when it gets tricky because a Medicare supplemental plan does require underwriting, but within the first 6 months of joining Medicare, there is no underwriting for that. And of course, there's different special underwriting specials that we could discuss at a future time. This could get a little bit tricky. That's why talk to your licensed insurance agent that knows what they're doing. Okay. Does Medicare offer other types of plans or programs to get health coverage? Yes. Medicare may offer some other plans and programs in your area. Some provide both Part A hospital insurance and Part B medical insurance coverage, while others provide only Part B coverage. Some also provide Medicare drug coverage Part D. They have some but not all of the same rules as Medicare Advantage plans. However, each has special rules and exceptions, so you should contact any plans you're interested in to get more details. Medicare cost plans. Medicare cost plans are a type of Medicare health plan available in certain limited areas of the country. In general, you could join even if you only have Part B. If you have Part A and or B and go to a non-network provider, Original Medicare covers the service. You'll pay the Part A and Part B coinsurance and deductibles. You could join anytime the Medicare cost plan accepting new members. You could leave anytime and return to original Medicare. You could join a separate Medicare drug plan, or you could get Medicare drug coverage Part D from the Medicare cost plan if offered. You could choose to get a separate Medicare drug plan even if the Medicare cost plan offers Medicare drug coverage. You could only add or drop drug coverage at certain times, pages 80 to 81. Go to medicare.gov/plan-compare to find out if there are Medicare cost plans in your area. You can contact the plan you're interested in for more information. Your state health insurance assistant program, SHIP, can also help you. Go to pages 114 to 117 for the phone number of your local SHIP. A trusted agent or broker may also be able to help. Medicare cost plans, I don't see these around in my area, so they are limited depending on your regional area. Program of All-Inclusive Care for the Elderly, PACE. PACE is a Medicare and Medicaid program offered in many states that allow people who otherwise need a nursing home level of care to remain in the community, like a home, apartment, or other appropriate setting to qualify for PACE. You must meet these conditions. You're 55 or older. You live in the service area of a PACE organization. You're certified by your state as needing a nursing home level of care. At the time you join, you're able to live safely in the community with the help of PACE services. PACE covers all Medicare and Medicaid covered care and services and other services that the PACE team of healthcare professionals decides are necessary to improve and maintain your health and wellness. This includes drugs, as well as any other medically necessary care like doctor or healthcare provider visits, transportation, home care, hospital visits, and even nursing home stays when necessary. If you have Medicaid, you won't have to pay a monthly premium for the long-term care portion of the PACE benefit. Okay. If you have Medicaid, you won't have to pay a monthly premium for the long-term care portion of the PACE benefit. If you have Medicare but not Medicaid, you'll be charged monthly to cover the long-term care portion of the PACE benefit and a premium for Medicare drug coverage Part D. However, in PACE, there's never a deductible or co-payment for any drug, service, or care that the PACE team of healthcare professionals approves. Visit medicare.gov/PACE to find out there's a PACE organization that serves your community. So I'd say these are pretty good programs. I've visited some PACE places and they are pretty new and nice. It's really intended for those that we want to keep at the home, right? Instead of going to that skilled nursing facility. So this allows the senior to go to this place, have lunch, maybe dinner, snacks, do activities, celebrate different holidays and so forth, have a community of other seniors, and also have the healthcare there. Like I've seen ones where there's the clinic there, the physical therapy, dietitian, they even like style your hair, do your nails. So a lot of that seniors that aren't as active or don't have a lot of friends, family visit, or however, can be with a community. I'd say as you are growing older, a community is very important to stave off mental illness or loneliness. Um, that can actually make people quite sick, just being alone and not having any interactions with others. So PACE programs are definitely great in my opinion. Of course, not every PACE organization are the same. Some may be better organized than other, have better activities, or just have a better sense of level of care. But it is a great concept. Very nice for those people that need that sense of community, want to stay at home, don't want to go to skilled nursing. So PACE definitely does take care of them. Medicare innovation. Medicare develops innovation models, demonstrations, and pilot initiatives to test and measure the effect of potential changes in Medicare. These initiatives help find new ways to connect you to value-based care, which focuses on better quality of care, provider performance, and your patient experience. These initiatives may also include lower costs and may offer you extra benefits and services. They operate only for a limited time and for a specific group of people and or offered only in specific areas. Examples of current and future models, demonstrations, and pilot initiatives include innovations in dementia, primary care, care related to specific procedures like hip and knee replacement care, cancer care, skilled nursing facility care, or rehabilitation care, and care for people with chronic kidney disease and end-stage renal disease, ESRD. Medicare also explores innovations through accountable care organizations, ACOs. Ask your doctor if they participate in these models, demonstrations, and pilot programs, what it means for your care. To learn more about the current Medicare models and demonstrations and pilot initiatives, call 1-800-MEDICARE, 800-633-4227. Go to pages 10 to 14 for an overview of your Medicare options. So I don't see this a lot, but definitely talk to your doctors if they participate in this type of innovation. Well, so we're actually more than halfway done through our journey on this Medicare NU handbook. We are going to talk about Section 5 on page 75, Medicare Supplement Insurance Medigap. I don't want to start on this quite yet since we don't have enough time. About 3.5 minutes left. So, what's on your mind? What's the state? I would say a lot of seniors are concerned based on the current administration on what's going to happen to Medicare. Um, there are maybe cuts to Medicare and so forth, but I'm just the type that, yes, we need to be proactive in regards to the updates, but also not worry about what's to come if it hasn't come yet, right? I am hearing that Medicaid and Medi-Cal in California, they may bring back the income limits. So let me touch upon that. So a couple years ago, not being precise, but there was an asset limit in regards to if a person was eligible for Medi-Cal, which is Medicaid outside of California. And if you did have a certain amount of threshold assets, then you did not qualify. Then they changed it to if you have 100,000 or less in assets, then you will qualify for Medicaid, Medi-Cal. And then they eliminated the assets portions of the Medicaid qualifications. So what does that mean? That meant if you had zero income or less income, you're lower than the poverty level of that year, even if you had $1 million in the bank, you were still eligible to qualify for Medicaid, Medi-Cal. Medicaid, Medi-Cal has a lot of great benefits, such as premiums being paid, co-pays, co-insurance, literally nothing, drugs costing you very little, covered drugs or nothing at all. So it could have been a benefit of people in that space. However, I'm hearing maybe 2026 that asset limits are going to come back. So definitely keep that in mind. Definitely Medicare is here to stay. But with budget cuts and different things, we will just wait and see what will happen in regards to that. I do advocate for fraud, waste, and abuse because we shouldn't be wasting tax dollars on frivolous things or things that don't make sense, but we shouldn't take away so much for the de-benefit of our seniors. Well, till next time, my name is Jennifer Lee, your host at Medicare 360. I look forward to seeing you again next week. Take care. Bye-bye.